too much, but I think needs a little bit of attention. Approximately 15% of South African women are affected by urinary incontinence. More women than men suffer from this condition. Urinary incontinence is a condition that is the leakage of urine and cannot be controlled. The good news is it is curable. Joining us now is Dr. Paul Swart. He's a urologist from the Urology Hospital in Pretoria. Dr. Swart, thanks for being with us and welcome to Morning Live.
Good morning. Thanks for having me, but I'm not a urologist. I'm a gynecologist working at the Pretoria Urology Hospital with the other 20 urologists.
I am so happy to hear that. Okay, I've got your name completely wrong then. Thank you very, very much for correcting us. I mean, there's a major difference between the two. Dr. Swart, if you could perhaps just enlighten us a little bit more about urinary incontinence. I mean, what I understand about it is basically you are not able to hold in your urine. Your bladder or whatever it is not strong enough. I mean, you tell me more about this, though.
Well, let me say there are two major types of urinary incontinence. The one being stress incontinence, where if the intra-abdominal pressure increases, like when you cough or sneeze or jog or jump on the trampoline, that you will leak some urine. And then there's a second type of urinary incontinence, which we call urge incontinence, which it's a condition where you get a sudden urge to empty your bladder, which is difficult to defer, and you cannot continue to do what you do, and you've got to go to the loo quickly and sometimes do not reach it in time, and that's a condition that we call overactive bladder. And then the mixed picture where you have both of those conditions.
Yeah. Okay. So it's I mean, it's an overwhelming urge. I know of a lot of women that do go through this. I mean, we'll chat about the differentiation between men and women in a short while, but let's focus a little bit more on women. What causes it?
Well, just because of their anatomy, women are more prone to develop stress incontinence. Because of the specific anatomy of women and the difference between men and women. So the first major determinant would be the gender of the patient. Also, pregnancy and childbearing is a major contributor to subsequent incontinence. Also, patients that are obese, patients that have chronic intra-abdominal pressure increases, such as people with a chronic cough, patients that are constipated will suffer from this, and also patients with recurrent bladder infections or chronic low-grade bladder infections. The menopause is also associated with an increased risk of urinary incontinence.
Yeah. Is there an association with age? Because a lot of people think, oh, well, you know, the older you get, the harder it is. But I'm not sure if that's a myth or if that is actually a factor.
No, there certainly is an association with age in different ways. As patients age and pelvic floor muscles deteriorate in strength, there's less of the normal mechanisms that prevent occlusion of the urethra, the little pipe through which you urinate, and then you age, and as you age, then you leak when you cough and sneeze. Furthermore, there is less compliance of the patient's bladder, and the bladder muscular layer is less strong. It ages like the rest of an elderly patient's muscles, and then it doesn't empty the bladder properly, and the bladder becomes less elastic, and you have to go more frequently. Also at nighttime, in aged patients, when they lie down, they sometimes mobilize some of the fluid that accumulates in their legs during the day, and then they have to empty their bladders more frequently at night. And this is a serious condition which is associated with increased morbidity in these patients, because particularly the very aged and fragile people, frail people, when you get up at night and you have to rush to the loo, it's a dangerous situation when it's dark and you're in a hurry. So patients do injure themselves in this way. It's a major contributor to poor quality of life.
Yeah, I believe so. I mean, and you also don't want to be too far away from a toilet, and you feel, you know, leading a normal life is quite difficult. But there are, this is curable. I mean, this can be fixed. How? How do you go about this?
So when patients present with stress incontinence, they'll typically go to a urologist first, obviously to the general practitioner, who will then frequently refer them to a urologist or a gynecologist. And at Pretoria Urology Hospital, there are 20 urologists, and they treat this. Now, with stress incontinence, it's typically starts with lifestyle modification, such as weight loss, which has been shown in good scientific studies to be extremely effective in preventing stress incontinence. Also, you'll do physiotherapy with physiotherapists to do Kegel exercises and neurofeedback mechanisms to strengthen the pelvic floor. And if this doesn't have good enough effect, then one reverts to surgery, where you do small surgery. Usually the patient is in the hospital less than 12 hours with extremely good results. As far as overactive bladders are concerned, usually you also start with lifestyle modification, where patients have to do pelvic floor exercises again, and to do lifestyle modification in the sense that you have to try to retain your urine a little bit longer, and bladder retraining it's called, and then we exclude diseases such as prolapse, which can be associated, and chronic bladder infections. And then the medication that we use, it's usually a group of drugs that we call the anticholinergic drugs, that we use for these patients. These are drugs that relax the bladder wall and are quite effective. And sometimes the side effects make it less effective to use for particularly elderly patients. And then we also use Botox injections, where you inject Botox into the bladder wall, or eventually neuromodulation, where you implant a neuromodulator. So there's a whole range of therapies that one can go through.
Amazing. Absolutely interesting. Thank you so much. I think we've helped a lot of people this morning who perhaps thought that all hope had left them, but there certainly is help at hand. And also, I mean, what I'm hearing is men, particularly with prostate problems, also do suffer from this. So you can get help. Visit www.urology.co.za. You can get more information there and treatment as well. Talking to us there from our Pretoria studio is Dr. Paul Swart. He, in fact, is a gynecologist, not a urologist, as we'd said a bit earlier in the program. So, yeah, that's the stories. Please get some help if you do indeed. Right.